Okay. Good afternoon, dear colleagues. Hello. I'm Dr. Mai Fawzi, and I will be moderating this session. All right. First of all, I would like to thank the Congress Board for this honor and to thank the chairpersons and the speakers for their contribution and effort. Sometimes in our clinical practice, we are faced with, what do I do? A very silly question that has nothing to do with our experience, but could be due to the difficulty of the medical query or due to lack of consensus. So sharing experiences from others with high experience is what we are going to do today. In the revolutionary spirit of this Congress, we have chosen 6 topics that are do and don'ts in hepatology that we would like to share with you. Pruritus is a very disturbing and distressing symptom. It can cause social embarrassment, and the patient has very poor quality of life. What are the causes and how to manage? Where is the clip? Oh, waiting. Okay, thank you. Autoimmune hepatitis, an elusive and progressive disease whose poor patients, if undiagnosed and untreated, could have very high mortality, 50% within 5 years of disease onset. So early diagnosis and therefore treatment will lead to decreased morbidity and mortality. Our next topic has to do with the success of the presidential campaign that our dear president has made and has led to increased numbers of patients with sustained viral response. Are these patients risk-free, or are they facing multiple risks post-sustained viral response is what we are waiting to hear in this topic. Many patients are referred to hepatologists for raised liver enzymes in seemingly normal people who have no medical history related to the liver. What are the causes and how are we going to manage? Will we reassure or are we going to investigate further? A very important topic. Portal vein thrombosis is not to be forgotten, a disease that could cause and confound liver liver disease in general and occurs commonly in patients with liver cirrhosis and also without. How are we going to manage such a case is what we are going to hear presently. Lastly, our last topic. Recently, many non-invasive biomarkers have appeared that have been validated and also used in clinical practice to diagnose inflammation, steatosis, and fibrosis. Does this mean that liver biopsy has relinquished its role in diagnosis in the algorithm, or is there still significant importance for liver biopsy? This is our last topic.